today. It's Chip Chat. Is that what we should name it? With Chip.
Sure.
Okay. Well, we're gonna rant about peptides today, so stay tuned, okay? I'm Dr. Jen. I'm a double board certified physician, and my husband is in medical device sales. So we're both in the medical world, and we actually know what's going on because we actually work. We're not just like influencers.
True.
Yeah. I mean, I think one thing that I rant about a lot to you is that a lot of these people that we see, these influencers, they're like not actually seeing patients, they're not actually in the hospital. So we're not quite sure where they're getting their information
They're not
or their
doctors.
intel.
They're maybe a health coach, not
And
nutritionist.
I'm training health coaches, but the right way. The problem is there's health coaches that are diagnosing and treating, and that's a little sketchy, but
I mean, it's not sketchy, it's scary. I mean, you
yeah.
have people's lives in your hands and you have a health coaching certification. It's
Yeah.
kind of scary.
Well, and that's why I'm so excited for my health coaching hormone certification that we have a new cohort starting up in September. If you're interested in that, make sure you stay tuned because I'm working with my first class right now. But yeah, I mean, there was some weird things that happened with like one of my patients and a health coach where the health coach told her to eat like a bunch of dates and honey to help her hypoglycemia. And I was just like, that's terrible advice. It's just is. And then, I listed tons of studies, but it's about teaching and mentorship. And, that book I was reading that I told you about, Lead Like Jesus, was so good by Hodges. Just so good because that's how we want to lead. And we want people that we mentor to lead that you're not scared that they're going to surpass you in knowledge because that's the point. Like we want everyone to learn. So anyway, that was very humbling, that book. But anyway, we wanted to talk about peptides.
Yeah, peptides are crazy right now. There's a lot of people out there that are recommending dosages on peptides and selling peptides and making tons of money on selling peptides that are quote unquote for research purposes only. So they're selling peptides for research purposes only, yet at the same time they're giving their patients or clients or whatever you call them the dosages of what to take with these peptides and how often to take them. And it's insane. There's a guy that is, I don't know, he says he has $1 million in inventory right now. And, he all throughout his Facebook, he's got, people that he's selling them, it's $10,000 to get into the pepper firm. And so he gets their label put on the for research only peptides and then, charges them a less amount of money for the peptides and they're selling them to their own groups of people. And it's like everybody on the internet right now is doing this. And there's even a guy up in southern Michigan near where we used to live that just posted something about peptides and he now has a fitness company. And I commented on one of his posts and he was like, do you mean the non-FDA because they can't be FDA approved and patented? That's why they're for research purposes only. I was like, no, dude. They're for research purposes only because they're supposed to be prescribed by a physician and compounded by a sterile compounding pharmacy. Absolutely. You have people that are getting the dilutants. Who knows what it is? Is it bacteriostatic water? How much of whatever the component that makes it bacteriostatic is actually in it? You don't know. And they're mixing their own peptides. They're basically compounding their own peptides at their house. Whereas at a compounding pharmacy, you have pharmacists and staff that are trained to compound sterilely to make sure that you're not injecting any bacteria in your body and you're going to get fat. I mean, I bet none of you have seen a patient with fat necrosis, right? With necrotizing soft tissue infection. It's horrible. Yeah. Horrible, horrible, horrible. You've seen these, right, in the ER? Yeah.
Like we're just messing with something that we shouldn't be messing with and it's not safe. And people argue, well, it's not available to everyone. That's bull. I see what these people are charging for research use only peptides, and you can get that a similar price and have a physician guide you through it. It's just so scary. So let's break it down. So we're talking about peptides, and there's compounded peptides versus for research use only. And it's for research use only because it's not made in a sterile compounding pharmacy. And
a lot of it's from China.
Yeah, and a lot of it's from China.
Supposedly they're U.S. made, but they probably just shipped them from China and labeled them here in the United States, so they're quote unquote U.S. made.
Well, and to your point about the guy saying that they're not FDA approved for the conditions, that's true. A lot of the peptides are not FDA approved, but that's why you work with a physician who goes through informed consent with you and talks about it. And they're peptides, they're made in our body too, a lot of them. So that's what's really interesting. But also that comes to talk about like using things off label or not. I mean, if you even look at some like things like SSRIs or, certain medications, they're used off label a lot. So this is where it bothers me and I get like so mad, because this is where physicians should be allowed to practice medicine. Like that's why we went to school for not way too long. Actually, there's no shortcuts. We need to do that. And that's why, you should see a physician and you should demand to see a physician when you go places, because they just went through a lot of training. And
15,000 hours typically is the standard physician's training, right?
A lot. Yeah. And that just like, it's just like picking up on things. It's kind of like, security guards at church, like they're always scanning, like they're picking up, like they know what to look for because they've had practice, because they're police or served in the military. I mean, that just doesn't come overnight. And it does, just because you did a ChatGPT search about peptides doesn't mean you should start to deal them and call them by different names. It's really scary. So 503.
Yeah, peppers. Peptides.
503B, compounding pharmacies must validate every process according to the CGMP. Okay, so 503 pharmacies must comply with all these state board pharmacy regulations. They're regulated by the FDA. So 503 compounding pharmacies are very good facilities. And the regular compounding pharmacy down the street is not going to be compounding 503B peptides. It's a special kind of
It could be. They could be down the street from you.
Yeah, they could be down the street, but I'm saying the regular compounding pharmacy.
Normally compounding pharmacies aren't sterile compounding pharmacies, compounding injectable medications.
Yeah, and then the other compounding pharmacies that aren't, it costs millions of dollars for these facilities, and they spent a lot of money to do their own things like bioidentical hormones and stuff like that. And I'm friends with like all the compounding pharmacies because the pandemic. So that was great. And when you look at these pharmacy owners, they're obsessed with helping people be healthy. I mean, and we're all up in arms about these for research use peptides only, and they can do third-party testing and get COAs, but even on Reddit, I mean, I was looking at all these threads about COAs, which is certificate of analysis and third-party testing, and they even say that it could just do whatever you want, and then also the vendor has to catch up and test their batch. Sometimes it paused shipments for weeks. So if you're getting these peptides just like continuously, I bet you that COA, that third party testing, is not for the batch you have. I don't know. We're injecting these things into our body. It's so sketchy. And the compounding pharmacy that I use, that doesn't ship to all the states yet, but a lot, and I can get a lot of very useful peptides that I use with my patients. And some of the batch for MOTS-C specifically, it takes like a couple weeks. Sometimes my patients get annoyed, but I'm like, it's for your safety. So I don't know. This is really interesting when you go on Reddit and read about it. And when we look at peptide science, like that was huge and they shut down. And I even had friends that would occasionally like get their Epitalon and stuff just because they were desperate and wanted it. But my problem is, if you're that desperate to compromise safety, that's a problem. Now, what did I do when like a couple years ago, they shut down and put a bunch of these peptides on, the list for pharmacies that they couldn't compound them anymore. Remember that I was like so frustrated. It was after the pandemic and I'm like, I can't get thymosin alpha 1 anymore. And I'm like, I can't get these tools in my toolbox anymore. What did we do? We pivoted. We switched to oral formulations that were more like supplements. I use more bioregulators and got really good at using bioregulators in my practice. So we pivoted because we wanted to stay within safety zone. And it's really just crazy. I know everyone's desperate for health, but I mean, go read a book, be in nature, get sleep, work on your foundations, because that's another pet peeve is everyone is just like blasting themselves with multiple peptides, but not working on, the basics, because they're not working like with a doctor to actually like guide them through the process.
Research only peptides.
Using them or selling them?
Selling them.
What?
Oh yeah. Yeah. Because they don't think the government needs to be involved with this, right? Yeah.
So here's the thing with medicine. Okay. So I'll.
And I don't know this person. I know someone knows them well. Yeah.
Well, they should talk to. I mean, as Christians, we need to call out darkness and we need to hold each other accountable. So
yeah, they're actually trying to get him to take. They're like, you need to take these GLPs from me, you know?
And that's a conflict of interest too. I mean, but some people say that with integrative doctors that have like, like I have a private label supplement company and like I do that because I wanted my patients to have safe supplements and not get them off Amazon.
Right. And they don't have to take your supplements, right? So
right.
Yeah, they can order them if they want to.
Well, the other thing that's interesting is I mean, I had the opportunity like 4 years ago to private label peptides. Remember I told you, and it was like so tempting, and I'm like, but I can't because they're for research use only. Like, I don't care what you tell me. Like, I don't know. I don't get how you could be that desperate to inject yourself with something that you really don't know if it was sterile, where it was compounded. I mean,
well, it's like, for example, insulin, right? Okay. There's a lot of diabetics in this world, right? So people don't take insulin they mix themselves at their house or that they buy that's for research only insulin, right? I mean, who would do that?
This is a great study. Okay. In Swiss border seizures, less than 20% of the 1,190 doping products, including peptide hormones and growth factors, contained the claimed substance in the correct amount. Less than 20. So you're getting these for research use peptides only, and it might only have 20 might be correct. I mean, that's insane. I did a podcast with my friend who's a doc, and he's like, yeah, I mean, even if they say 99.9% pure, like, do you want to be the one? Like, these black market products in Germany contain numerous fake or non-approved agents, including peptide hormones and fusion proteins of unknown activity. You're putting this into your body. Like, what is going on? Examples, and this is from Consensus. This is it looks at all of the PubMed studies and puts in a nice little box for me. Heavy metals, toxic inorganic arsenics and lead up to 10 times toxicity limits, and falsified peptides from illegal internet pharmacies. Oh wow, that's where all these people are getting them from, internet. And it is greed. For me, it is sinful. It is greed. It is get rich quick.
Well, they got it.
And we need to. Well, I told Chip, I'm like, you just need to like message them, or you need to talk to these. They don't want to hear it though, because they're very greedy.
The guy that's here where we live is like iced out to the
in the Bible Belt, so everyone's Christian.
Yeah,
but we don't know if
I mean, selling millions of dollars per month of peptides on the internet.
But so Chip gets really mad because it will like pop up on his Facebook, and I'm like, Chip, I'm like, our treasures are not here; they're in heaven. Like, I want to be able to look at God and be like, I did not endorse these things to get rich. Do you know? I don't.
It's so tempting though to be financially independent.
We'll get there, but like, we have to get there the right way.
I agree.
It's not to hurt people.
There's so many people out there that are just.
And who knows? These people might have cancer. They might get cancer. I'm just not. I can't do it. So the other crazy thing is that, like I have people reach out to me all the time to try to like do their like peptide subscription or be an influencer for like all the time, and I'm like, do you like listen or watch my posts? So we have to crack down on it. And here's the thing, like the big pharma, all the GLP ones out there, I like a customized dose. I like my patients at B6 in there for nausea. I do things different. I don't do max them out all the time. I don't do those. I like my compounded from a 503 B pharmacy. Okay, let's go back into the contaminants. So if you're out there and you're taking for research use peptides only, like you probably shouldn't. You can use a compounding pharmacy and you can talk to a doctor.
You might spend the same amount of money, maybe just a little bit more. And you can even get compounded peptides online from some peptide mills that are legit peptides.
Yeah, but
then you're not getting guided really the way you need to be by your physician.
They're not, yeah. And here's the thing, I've been using peptides for almost a decade, and there's a lot of us out there that have before they were cool. And now people are using them wrong. Oh my gosh, remember our friend when we were out at dinner and he was on a growth hormone secretagogue? And I'm like, oh, tell me, like, how are you taking it? I'm like, I just want to make sure you're taking it, at night on an empty stomach, only 5 days out of the week. So 5 days out of 7, you need that 2-day rest to reset the receptors, give him a rest. You can't just push gas pedal. And he's like, oh, I didn't know that. And he was, and that's the other thing. Like, people are wasting their money. Like, if you take a growth hormone secretagogue on a full stomach, you're wasting your money. Chip knows. Like, remember, I wouldn't give it to you one night because I'm like, you ate, you don't get it. And I felt bad, but anyway, I'm
not the most compliant patient. I mean, let's be honest.
You would be wasting your money. But if I was in it to make a bunch of money to sell my peppers, then I wouldn't care how you would take it. And it's a lot of us are horrified about it. Like, doctors that care about patients that have been using it for a while. Okay, let's talk about more about peptide contamination. Endotoxin. This study, all 3 semaglutide vials from illegal online sellers, that includes your friend selling it on Facebook, has and people that are white label, or private labeling them. So all 3 vials has measurable endotoxin despite being sterile.
So I'll talk about endotoxins. So
Like
I'm a medical device, right? So I sell a skin substitute. And I used to sell one made from fish skin. Now I sell one made from cow skin as well as human skin. And endotoxin testing is a legit thing in my industry. Actually, there's products that have been taken off the market and companies shut down because they lied about their endotoxin testing results. So there's a product from a company called Integra, and they had patients that were getting severe headaches, right?
You're gonna throw Integra under the bus? I love it.
I mean, anybody can Google it.
Yeah.
Integra, it was called Primatrix, and it was pulled from the market. It just came back to the market, actually. But they lied about their endotoxin testing results, and they ended up getting sued for big money. And, patients were getting sick and getting bad headaches because of the forged endotoxin testing results. So if they have failed endotoxin testing, then that has to go away.
Yeah, they in 2023 voluntarily recalled all products manufactured at its Boston facility over a 5-year period. Were pulled because of endotoxin testing failures. This resulted in an FDA warning label. I mean, this is the stuff that goes on behind the scenes because it's all about money. Wow. Elevated endotoxins can lead to post-op fevers, inflammation, or serious infections. Mm-hmm. And how many times do those things happen in the hospital and they just blame whatever?
They're called hospital-acquired infections,
right? The poor surgeons that would hurt their, their record or whatever. Oh, wow, this is some major stuff.
Yeah, look it up. I mean,
do the doctors know about this?
Oh, yes, they do. Yeah,
so why would they want to work with a company that's shady? Why would a rep want to be a rep?
Because Integra invests a lot of money into residency programs and a lot of money in educating physicians.
It's all about the money.
The money.
Well, and here's the thing.
Hold on. Let me interrupt you real quick. So on Facebook, the one guy was like, "Yeah, it's all about the money. That's why physicians have to prescribe these."
I was just going to talk about that.
Sorry.
Mm-hmm. No, it's true. And yes, we know the big pharma, they want this peptide money. Lorazepam is going through right now clinical trials, and that's going to be a $20,000 a month, medication that I think everyone should just have in their house, right? Lorazepam, I give it to you a lot.
What's it for?
To help the tight junctions in the gut. So it seals it up so fast, and it works in kids. I mean, that's what it's in the works for. Celiac.
Oh, really?
It helps with everything, like autism, everything. I mean, it helps. Well, I want him to swallow pills.
Injections.
You don't inject lorazepam.
Oh, you don't? We just figure out how.
Maybe the internet people have one.
Yeah, internet people. Do you have any injectable lorazepam?
No, but
for research purposes only.
Here's what this is how ridiculous it is. I'm at the point where I just, Chip knows, I'm so disillusioned with being a doctor right now that I just sometimes I'm I'm done. He knows. I talk to him about it. And I know God will bring me the people that he needs to bring me. And, if he wants to grow my YouTube or my podcast, he will do that. So we will just, be obedient. And one of the things we did want to talk about this craziness. Okay, I have to get back to the list. Okay, so endotoxins, lipopolysaccharide, even on, what's that one guy's podcast that starts with an H, Huberman. He talked about peptides and lipopolysaccharides and the concern for that. So, this is something that everyone is concerned about. Okay, growth hormone labeled injections with no active content. Products sold as IGF-1 actually contain EGF. They put some testosterone ester and some steroids. Ooh, custom synthetic peptides found to contain 20 to 43% undeclared mannitol.
What's mannitol?
sometimes we would use it, like you could use it in neurosurgery for really bad swelling of the brain. So it's like an osmotic controller kind of in the body.
Kind of like an anti-inflammatory?
No,
No.
like diuresis, like to decrease swelling in the brain.
Okay.
So falsified peptides show very low purity, as low as 5%, and large dose variation, plus toxic inorganic arsenic and lead, raising concern for acute and chronic organ toxicity. Semaglutide vials from a legal pharmacy that had only 7.7 to 14.4 purity versus 99% claim, because that's what we see on every one of those bottles. 99%.
So even if it was 99% pure, right? So think about it. 1 out of 100, 10 out of 1,000, right? 10 out of 1,000 people have a bad reaction to something. Yeah. Nothing would ever fly if 10 out of 1,000 people had a bad reaction or died from it. Yeah. Never, ever, ever. Reviews note reports of toxic contaminants, bacteria, fungi, and product process related impurity and falsified polypeptide drugs and supplements. Okay. And I talk about this a lot with buying supplements on Amazon, and like I had a patient go into liver failure from supplements, and then right when we stopped it, no liver failure, and it wasn't one of my supplements, but it's sketchy. It's hard. We don't want to do harm. And this is where integrative functional medicine gets like a snake oil type view because of this stuff, but it's totally out of control. And like my heart is sad about it. I mean, Chip knows that I was excited at first that I'm like, people actually know what peptides are, but now I'm like, it's just out of control. And I don't really think people are getting the results they should from it. Well, people are getting the results they want sometimes, and those results are the ones that are aired out in the public on Facebook, like, oh yeah, I lost 30 pounds from this. But they're losing GLP they're probably losing all their muscle mass because they have no idea what they're doing. Exactly, right. Yeah. Well, and this is crazy. It's the metabolic elite product, right? What's that called? Yeah, we love metabolic. Aquatrophin. Yeah. It is good it's like a natural GLP-1. So you could use that, do it right, get the basics, and go from there. Remember my friend, her mom went to a med spa, or no, it was like an integrative medicine place in Florida, and they made them come in every week for their injection. There's a place. And then they told her she would be on this the rest of their life. No, I actually tell my patients that the goal is to get off of it. We'll get on it, fix the insulin resistance, and then get off. And then another shady thing, remember that doctor, that aesthetics doctor, that like from maybe pre-care when I used to do aesthetics, that his place was shut down because he was doing like weird stuff with peptides or something. Well, there's a place in Nashville. I don't know if it's Male Excel or I forget what it's called. Maybe that's not it. But there's a place in Nashville, like even to get hormone replacement therapy, you have to come to their place once a week, do an injection once a week for your testosterone and peptide. I just don't think that's crazy. Cool. Yeah. Like from a multi-dose vial? That's weird. Yeah. I mean, you're allowed to utilize the multi-dose vial. I mean, maybe not anymore. You used to. Remember when you trained? Like the nurses would always give multi-dose vials for different people. Right. Yeah. I think I don't know. It would depend. Yeah. But I don't think people in general should be going to a med spa for peptides, hormones, anything, because it's just like a weekend course and done. So just don't. And once again, all of them are a weekend course and done. You might go to a med spa that has a pretty rough training that Jenny does. Probably not likely. It's probably a mid-level. It has, let's see here, 500 is how much of 15,000? Yeah, I don't know. Like 500 hours compared to 15,000 hours of training. Actually, not even including your fellowship, actually. Yeah, and you want to make sure training. People always ask, like, how do I know if they're trained? Well, you look at their website. Did they do an actual fellowship? Are they board certified in integrative or functional medicine? Have they had good mentorship? Have they been doing this for over a decade, or did they just start because it's bad? Yeah, because it's really like the mentorship and seeing patients. The same reason why we take our kids to a board certified pediatrician, because they did a residency in pediatrics. So the big thing for me is, did they actually spend the time doing a fellowship or residency? Sometimes there's a combined residency with integrative medicine. And then I sit on a board that helps boards get people board certified for integrative medicine. So I review people's training, and then they have to sit for a board exam. It's not a pay to play like
you just pay and take these courses and there's no exam and you just slap stuff on.
How hard was that test?
It was hard. Remember, I like had to memorize like the entire Raquel book, and that's what we write the questions from. Because we just, I mean, I help write the questions, and we like.
She studied her butt off for that test.
Yeah, and yeah, it was really hard. And
it was a 2-year fellowship. It wasn't like she was just taking a course on the weekends for a month here and there. It's a lot.
It takes time. And as Chip knows, like today we were at my son's baseball tournament and I was just reading papers the whole time, when he was not playing, when he was benched and stuff. I was just like watching the game, but also like reading papers. I was reading the latest studies on just FSH suppression in late perimenopause. So I mean, to me, that's not work, it's enjoyment because it will help my patients. But this is the same thing. Like, I'm in a group of just physicians and that talk about peptides on Facebook. And we've been going strong for like, this group's been around for like 8 years and we challenge each other and we just want our patients to be safe. So I guess, what would you say to people that are just like so desperate, but that they're injecting something?
It's not that they're desperate.
What is it?
It's that the people that are selling to them are salespeople.
It's true.
They're in it for the money. Don't be deceived. I mean, that's the problem, right? You have all these people that are fake and they're con artists and they're selling things that aren't designed to be injected into your body to inject into your body.
Yeah.
And it's just not the way you should do it. Like you said, it's not safe.
Well, I'm trying to like be like, maybe they don't know. So that's why I want to educate that.
Actually, oh no, my phone's right here. The comment that guy said about, he was basically arguing with me on his post about peptides. And one of his friends was like, I'm having the same problem. All these people are saying they're peptide experts and it's all for research only. And, do you have any suggestions on where to go? And I was like, well, my wife has been doing this a long time and practicing medicine for 20 years. And like, here's her Instagram. You can check her out. But I mean, just do it the right way.
Yeah, and if you want to know, like the peptide expert, like I know them, like the owners of all the peptide companies, that I trust, like companies. Or the compounding part, like I personally know them from meeting them at conferences and listening to them lecture, and I've lectured on peptides like at conferences, multiple conferences. So I just think that we all just need to have more caution. And I love talking about peptides with my patients, but a lot of the times I'll tell them, I'm like, you're not ready yet. You're not ready. We will bring it in later. We need time. We have to, I call it peptide prep. I have a peptide course. If you want to just be more intelligent yourself about peptides, and then find a doctor who can order in your state from a compounding pharmacy so it was made in a sterile facility and batch tested. Like that. I mean, I don't want some rando from China making something that I'm injecting into my body. I mean, during the pandemic, I didn't inject anything into my body. So why are we okay with it now? Because I feel like it's like the same people that were like, I don't want that in my body.
Right? Yeah.
They're like, I'll take research.
But yeah, give me all the stuff that isn't like really tested. Still isn't.
You keep saying that word. So
you can't say that word.
Yeah, so.
But you can say peptide?
Why is that one
guy say peppers instead of
I'll probably get flagged for this too.
Okay.
One of my good friends, Nat Nidham, you met Nat, the black hair and she's so sweet. Her whole Instagram wiped.
Really?
Yeah, she's like 400 followers now. And Nat has been around. She's a peptide expert. She's not a physician, but she is a peptide expert. Like she knows what's going on. But everyone now is just jumping on the bandwagon. It's really hard to see, and we just need people to be careful. And we wanted to do this because Chip was very passionate about it.
Well, it's just, I don't know, it's frustrating because I would really love for us to be able to sling these per research peptides to everybody and just make boatloads of money off of it. But at the same time, we're not doing that because it's not safe. This is not right.
It's about integrity.
Yeah, and I mean...
safety.
Yeah.
I know there's a lot of things that Chip's like this. You could just make so much money doing this as a doctor, but I'm like, it's not ethical. It's just not ethical. And I think that's what's like when you see, but that's the thing, like my love, like I don't fear man, or I don't like, it's not about the money. It's like about God, right? Like I fear God and
Yes, but if we had boatloads of money from slinging
Illegal
peptides
peptides.
illegally on the internet and lying to people about what they're supposed to be doing with them, then I mean it'd make things a lot easier, wouldn't it? For a short period of time.
Yeah, but that's like creating instant gratification for
like not going to heaven, maybe.
Yeah.
I don't know.
Remember the sermon from a couple weeks ago? I also think people just don't know, so they have to be educated. So I assume, I try to think that they don't know. And then you educate them, but I can tell within a second when someone's defensive or not if they really know.
Right.
So I mean, it's hard though, but some people are.
I mean, doesn't it say on the vial for research purposes only?
Yeah.
Yeah.
It's
not really any way.
And you have to reconstitute it yourself.
Yeah.
So if you have to reconstitute it yourself, it's not from a compounding pharmacy. So from a
Right.
compounding pharmacy, it comes, it has your name on it, your dosing from your doctor. You pull it out, though, but it's already ready to go. It's just, I get it. Like, it's so tempting. Sometimes I'm like, I just want to stock up on peptides and mix them, if there's Armageddon, and mix them myself. But then I'm like, but at what risk? We don't know if you're injecting heavy metals, like endotoxins, like into your body. What harm are you doing? Like, is it like, that's scary?
There's a gym here in London that sells research only peptides. Yeah.
You're not just like putting it on topically or something. I don't know. It's all, it's crazy. I just don't, it's almost like an evil force. It's like people don't have eyes to see how crazy this is. They just don't have eyes to see. And it's crazy because to me, it's just like very clear. Like, I just read all the studies and people will still be like, yeah, but
it's tested. I have a COA that says it's 99% pure. Yes.
Yeah, 99.9. No, it's fine. I think that it brings up good things. I think we live in a broken world.
Right.
But we need to educate people and not give them shame. So if you are selling illegal peptides, repent and shut it down. Do honest work. I mean, at this point, I would say.
Yeah.
This is just not honest work. There's a bunch of people that are just going on the bandwagon. It looks good and they'll full stomp on whoever is in their way. Yeah. And that's why I'm just trying to trust the Lord will bring me the people that he wants me to be in front of. So this is so funny. This consensus review, it's just so bad with all the peptides. Only 58% of the samples of the drug contained it alone. 6.4 had additional undeclared active ingredients. 14% contained only other undeclared activities or none. So you don't know what you're getting, guys. This is really scary. And
be careful.
Oh my goodness, look at this. TB 500, content not systemically consistent with descriptions, mainly sheep, ECM, and blood proteins.
ECM is extracellular matrix, by the way.
So this is sketchy. I'm going to put a bunch of these studies. I'll put some of the studies in the show notes. So I don't know, y'all might turn into sheep. Oh my gosh, actually that's ironic. Sheep. Like they're sheep in the crowd. Yeah, like going with
being sheep, just following everybody.
Just following everyone. Yep.
Like ducks are like that.
Do not get your peptides at your gym. So here's the thing. We're just trying to shed light on the darkness because the black market for peptides is that. It's called black market because it is dark. And there's a lot of bad things going on in the world, and we just need to be good stewards of our bodies and injecting foreign material, endotoxins, arsenic into our body. That is not going to help. So I hope this episode helped share.
I mean, you get me on a podcast and I'm going to speak.
Yeah, that's true. Okay, well, that's us signing off. Thank you.
Bye.
Bye.